Awesome. Scooch over. Awesome. So before I would enter the patient's room, I'm going to go ahead and check the patient's chart. I would shut the door to provide patient privacy. I would go ahead and do hand hygiene or perform hand hygiene. And then I could go ahead and introduce myself. So, hi, I'm Miguel. I'm going to be your nurse. Do you mind telling me your name and date of birth?
Yeah, I'm Ricky Quiros, and I was born December 1st, 1998.
Okay. Now, do you mind if I check your wristband real quick? Awesome. Thank you very much. So after using 2 identifiers, we now know that we have the right patient, so we can go ahead and let them know what we're doing and then go ahead with the assessment. So today what we're doing is we're going to be doing an abdominal assessment and be checking your stomach for any masses, lesions. I'm going to go ahead and listen to your bowel sounds. Then I'm going to go ahead and percuss, palpate. I'm going to feel around, see if I feel anything out of the ordinary. But I'm going to start with some questions. How often do you have a bowel movement?
Twice a day.
Twice a day. Okay. And how many times a day do you pee?
4.
4. Okay. Do you ever get any stomach cramps?
Only if I eat spicy food.
Okay. All right. Only if you eat spicy food. Have you ever had any stomach surgeries?
No.
Like, okay, so your appendix is still there, everything's still there. All right. No gastric bypass or anything?
Nothing.
Okay. Awesome. Thank you. So now I'm gonna go ahead and I'm gonna have you lay down actually.
Okay.
Yep. All right. Do you mind lifting up your shirt? Thank you. Yeah. No. Yeah. You're good. Okay. So, just looking at the patient's abdomen, skin tone is appropriate for ethnicity. There is pink undertones. Yeah, I'm not seeing any masses or any lesions. So now that I'm done with inspection, I'm going to go ahead and auscultate. But before that, I'm just going to go ahead and feel the skin. Okay. Sorry. I got cold hands.
It's all good.
Okay. All right, patient's skin is dry and warm to the touch. Okay, so I'm going to go ahead and auscultate with my stethoscope here. Making sure I have the right side. I do. I'm going to split up the patient's abdomen. Sorry. There you go. Okay, that's as good as it's going to get. Okay, I'm going to go ahead and split the patient's abdomen in 4 quadrants. So down, vertically, and then horizontally. So when I auscultate, I'm going to start off with the patient's right lower quadrant. Right. Okay. Okay. Sorry if this is cold.
You're fine.
So bowel sounds were heard in all 4 quadrants. And now, while I'm auscultating, I'm going to go ahead and listen for any bruise in the patient's arteries. I'm going to listen to the iliac, to the renal, and I'm going to listen to the aortic. Using the method of making a V with my fingers, I'm going to start off with the renal. See. Okay. Okay. Oh, and the aortic. Sorry. Okay, perfect. I didn't hear any bruise, and I didn't hear any abnormal sounds whatsoever when listening to the patient's arteries. And I should know that the umbilicus is midline to the patient's body. I already said that there's no masses, no lesions. So I'm going to go ahead and I'm going to percuss in the same spots that I auscultated in. So. All right, so now I'm going to go ahead and palpate the patient's stomach. I'm going to be feeling for any masses in the patient's abdomen, and I'm going to be doing a circular motion just because they could move around. I'm going to start off with a lighter palpation, and I'm going to start in your right lower quadrant. Okay.
Mm-hmm.
And if you feel any pain whatsoever, go ahead and let me know, okay?
Okay.
All right, I didn't feel any masses, no lumps during the light palpation. So now I'm gonna go ahead and go a little deeper, okay? All right, perfect. Shut up, dude. No pain?
No.
Okay. Nothing?
No.
Okay. So, no... So I'm getting a phone call right now. I'm gonna X that out. I didn't feel any bumps whatsoever. No masses during the deep palpation. So you can go ahead and put your shirt down. And you can go ahead and sit up.
Okay.
So for this next part of the assessment, I'm going to want to educate the patient on something. So something, like a big problem in men is testicular cancer. So to check for testicular cancer, every once in a while in the shower, just go ahead and feel your testicles, see if you feel any bumps, any masses, you know. And then if you do, you go ahead and let your doctor know. They can check that out for you. It's just best to, you know, like if you do have something, to go ahead and check it out before it gets any more severe.
Okay.
Got it? Like, do you mind repeating that back for me?
So I should check my testicles for bumps and masses.
Yep.
And if I do notice, I need to talk to my doctor.
Yeah. Okay. Very good. So patient has proven that he did learn, or he did absorb that information. So just to recap, no masses, no lesions were seen on the patient's abdomen. I didn't feel any masses during palpation. No bruise heard in the iliac, renal, or aorta. And yeah, I think that's all. So